Nobody wants to talk about the other ones that we have that are creating a havoc in our society. So we want to look at an update on coronavirus and also update on other viral hemorrhagic diseases that we have suffered in this country and the world at large, and the ones that we are still combating with, and the ones that are yet to come. Are we proactive enough in all of this? These are many more we're going to be looking at today on the program, Healthy Living. I'm Adisu also, again, like I said before, and I shall be discussing with Dr. Barry Ojo, who is a consultant family physician, is here with us in the studio, and we're going to be looking at this in a moment. Happy to have you join us today, Doctor.
Thank you, Adisu. Yes,
okay, let's quickly look at an update on coronavirus, because as it seems, I was at a function yesterday, and it was a huge crowd. Surprisingly, only 2 persons were wearing nose masks, and I'm beginning to wonder if nose masks is not a thing of the past, because some persons were even looking at these 2 people as strange, like waiting to do this once. You understand that kind of a thing. So I said, okay, let's look at updates on coronavirus.
Yes, what's happening? You agree with me that even the last burial of the Queen, resort of England, almost virtually every person in the crowd were not on face masks. But that's not to say that we don't have new cases of coronavirus. Especially in Europe and Asia, even in America. Now, the world population is close to 8 billion people, and coronavirus has affected so far over 630 million people. Very sadly, now, we're close to 6.5 million deaths. And America alone suffered over 1 million deaths. Over 1 million deaths, yes. Well, here in Africa, the only disasters we had was in South Africa, where they had over 4 million cases of coronavirus, and they had 102,000 deaths so far. You know, in South Africa that the 4th wave actually started, but only to discover the 4th wave was not as fatal as the 3rd wave was. So, but generally speaking, coronavirus is the coronavirus. A lot of persons still have it, especially in the diaspora, and we're trying to enlighten the public that, look, coronavirus is not a thing of the past, because the stage we are now is the elimination stage, and the final stage is always the eradication stage. So, again, if you look at the occurrence in Africa, you still agree with me that it has to do with the weather, has to do with the melanin skin, talking about the pigmentation and all that. For instance, countries like Egypt, countries like Morocco had more affectation compared to Nigeria that had less than 35,000 people affected, 350,000 people affected, and only about less than 3,155 deaths. In Ghana, they had about 170,000 cases, and they had less than 1,000 deaths. So that is because we are blacks, we have higher melanin content, the weather is almost a hot weather. You will see that very recently, Europe suffered a heat wave. And in that period of between June and July, the coronavirus dropped drastically. In fact, UK had over 23 million cases of coronavirus. And they suffered close to 30,000 deaths. But on the whole, what we want to remind ourselves today is that the viral hemorrhagic disease that we'll be discussing shortly has some correlation. There's some similarity between these diseases and coronavirus. That's why we are still talking about face masking, hand washing, distancing, and that. Most of these diseases are airborne. Some of them are very contagious. So if we want to forget coronavirus, let's remember that there are so other diseases that are fast killing. So but for coronavirus, Africans have done well, some part of Asia has done well. Though India had the second highest devastation, they had over 500,000 deaths. But all the same, let us so that for those of us who are always traveling, or maybe the diaspora, we should always remember that coronavirus is still much predominant over there in Europe and America. So it's good for us to remind ourselves that face masking in the crowd is very important, maybe in a public place, and of course hand washing, the social distancing.
It seems as if you're speaking a different language now, because somebody will say, I beg, coronavirus is no more here.
No, I agree with you. One of my patients came to my
office. We don't even wash hands anymore.
No, I agree with you.
We do things in this
2 days ago, and she was on this black color face mask. Oh, madam, this thing, are you not suffocating? There is suffocated. So, but what I'm trying to say is that let's realize this, that diseases like Ebola virus is killing a lot of persons across Africa, especially in the Democratic Republic of Congo.
I was going to say that.
In 2014, we have the story of Ebola. Between August and October 20th of 2014, Nigeria was ravaging, where we lost our dear doctor to the devil, who lost her life in trying
to save the
Ebola
African
disease
population.
Is one disease that if there's a suspicion, face mask is compulsory. Of course, your hand washes and this social distancing is very key. You know, the Ebola disease is the vector is normally one of these string bats. And most of the time, the incubation period is between 2 to 21 days. And why we call it the viral hemorrhagic diseases? They have been covered up hemorrhagic. Most of this, the dengue fever, the Ebola virus, the Lassa fever, most times patient tends to nosebleed. Or they will go what we call ecchymosis. There must be some bleeding episodes. So it affects even the blood cells. So that's where the fatality rate is very high. So I try to alert the public that the Ebola virus is real. So for those of us who are moving across the borders,
the African borders,
when we are looking at this virus, let's not forget our safety devices. So when it comes to face masking, social distancing, and of course hand washing, it's very, very key. But the Ebola illness affects the lungs, affects the other vital organs like the liver and the kidney. So it's actually a viral illness that causes a lot of damage to the vital organs in the body. Then if you look at the yellow fever obviously has come to stay. You will not talk about the eradication of yellow fever. But the good news about
even with the vaccine.
Yeah, in the last 30 years, yellow fever has come down even in this part of the world because of the vaccination. But again, how many people, Nigerians don't have this up to 90% coverage of vaccination? It's very not. So a lot of people still have their reservation against vaccination. But the yellow fever is now part of the NPI vaccination schedule, which is given to children by 9 months. So again, very recently, kudos to the state government. They have to allow people to move from marketplace, from place to place to give yellow fever vaccine. But a lot of people did participate. And yellow fever has come to stay. The difference between yellow fever and malaria fever is that there are some similarities, but the both are caused by mosquitoes. Because while the malaria is caused by the Anopheles fever mosquito, the yellow fever is caused by the Aedes mosquito, so fever Aedes mosquito. You have streptococcus mosquito, remember your biology. So at the end of the day, these illnesses can be transferable through monkeys. So it's not something, it's like those in the tree, so it's not something that somebody can wait by. But actually, there's no cure for yellow fever. What we do is that there could be symptoms like malaise, feeling body weakness, there could be yellowness of the eye, there could be muscle cramps and all that. So most of the features of yellow fever are not specific. So we said not because they can just become almost like abdominal pain and all that. But again, it is always good for us to know our vaccine status. Our vaccination status is very good.
All right, for the purpose of emphasis, let us look at the signs and symptoms of yellow fever. How would the patient present before running to the hospital?
First of all, what happens in any viral illness? The individual start feeling unwell. So patients will be feeling unwell, take anti-malaria, take some antibiotics, still not getting well. But incidentally, some patients will notice yellowness of the eyes. Then somebody start having even discoloration of their urine. Of course, there will be fever, persistent fever, take paracetamol, take all the pain, all the analgesics, patients not getting well. There will be malaise, patients will be very weak, no longer having enough strength to do some of these activities. Of course, there will be muscle cramps. I have seen a patient that thought that he was even having arthritis, only discovered it was yellow fever. You know, so, and all the abdominal discomfort, you know, the time you now run some other which cover all these features are there. And most times these things are between 2 and 21 days. Unlike coronavirus that is between 6 to 420 days. So what is most important is that once a patient has discovered these features, go to present to the hospital. You are taking anti-malaria, you're taking antibiotics, you are meeting the care, you are going to the chemist, the drug vendor, you are going to the pharmacy, and you are not getting better. So go to turn to the hospital. So this diagnosis we made. And secondly, even when you look at the yellow fever, there are other hemorrhagic diseases like dengue fever. The dengue fever is spelled as D-E-N-G-U-E, but it's pronounced as dengue fever. It has a lot of similarity with the yellow fever. The only difference is that it's also caused by the Aedes mosquito, but the dengue fever is more fatal than the dengue fever. There's also a vaccination of fever, but there's no cure. So again, it's a feature of a patient can be having bleeding to the nose bleeding. Patient can be having some skin changes. Of course, patient will be having some patients. I've seen some patients with dengue fever having leg swelling, even facial swelling. It has a lot of effect on the kidney and of course the liver. So most of these diseases, their symptomatology has intertwined. You cannot put your finger on them. That's why it's always good to turn to the hospital for clinical evaluation. But having said all this, the one that is closer to us in Edo State here is the Lassa fever.
The Lassa fever.
The Lassa fever is one reason why I will tell my nurses and every other health worker to always be on face mask. Because the Lassa fever is so predominantly playing like a bomber. Even a bomber has a viral center because of Lassa fever. How does it come about? There's this strange rat that is called the mastomids. The strange rat with this long mouth and all that. So, and that's the vector. So, and once this illness come again, what are the features? I have seen a lot of persons die of Lassa fever. they will say, oh, it was severe typhoid. Patients can, it could have, patient can come down as was an utter sensory. Well, patient can be in a comatose state. Patient will have abdominal pain. There will be persistent fever. Patient will be feeling unwell. Some patients will come with upper respiratory symptoms like cough and catarrh and all that. You might think, oh, could it be corona? So at the end of the day, what is most important is to quickly go for the testing. And ERA is a center there, where they will take samples for the use the PCR to discover whether it's Lassa fever. But the good news about Lassa fever is that once there's a high index of suspicion, you know that there's Lassa fever. Unlike dengue fever and yellow fever, there's some form of cure where you have to give the ribavirin tablet, then you treat systematically with a lot of rehydration. Most times when you discover it early, incubation period is 5 and 21 days. Once you discover it early, most times the patient gets better. But again, a lot of people will think it's malaria, it's typhoid. You will see some person thinking, oh, pastor, pray for me, I don't know what's wrong with me. I don't know the treatment. Whereas the nearest hospital can raise an index of suspicion. And that's the reason why it is always proper for every health facility to have, where you have this, your one-hand washing, the one in progress.
The bad news is that no matter how a patient presents, it's difficult for an average Nigerian patient to quickly go to the hospital. We'll wait till the
first port of call is the chemist shop, the pharmacy shop, and all that. And it's quite unfortunate that this one, because at the end of the day, these viral illnesses, once it's beyond 1 week, the fatality rate is very high.
It's very high.
That's what I've seen a lot of doctors lost. About 6 months ago, 2 doctors in Lafayette died of Lassa fever. Because their patient had Lassa fever, they did surgery, and the patient, they told they died. So it could have been avoided. But what is most important is that these preventive measures are very key. Nigerians is not to be marrying these preventive measures. We talked about the ceremony the other day. Some persons have been carried away. Some persons are having some of these contagious illnesses. For instance, Lassa fever can be spread from person to person, just like Ebola fever. But the beauty about Lassa fever is that easy testing. And Lassa fever is common in West Africa, Sierra Leone, Liberia, Nigeria, of course, very predominant in Edo State. So you can't take that away from us. Then again, in Ebola fever, out of the body of Congo, most of the time there are no treatment for these diseases. That's why it's a point of discourse at this point that you have to choose this kind of topic so the public be aware. And that is the reason why, if you come to my hospital, for instance, you will still see this neck papa and the part of face masking and all that. We had so many outbreaks of Lassa fever, very little. In fact, recently, more than 70 states were affected. So that's why we are telling people, when you are in the public, always be conscious that there could be some airborne diseases, there can be some human-to-human contact, because Lassa fever can be spread even semen, even vaginal secretion.
You know, we've been hearing of Lassa fever and all of that. Government have come out with so many measures, even individuals are doing their own. But yet, we still have, isn't there a way it can be eradicated? Isn't there a way it can be a thing of the past?
These are some of the ways to control any form of pandemic or any form of endemic disease. This public awareness, because the government alone cannot do it. All hands start to be on deck. But again, the problem we have in this part of the world is that people don't give priority to going to the hospitals. If incubation period of any illness is between as much as 1 day, 1 to about 3 weeks time, and supposed to feeling unwell 2 to 4 days, present to the hospital. Because they always, most of these decisions, from general hospital, they have their virology units. They will refer the person to the patient. So
what's the preventive measures now in all of these hemorrhagic
preventive measures, like we talk about Lassa fever now, all those, the issue of domestic measures like covering your food, covering your water, because some of these rats, they are in very many homes. So you have to, of course, bush burning, not keeping dirty environment, because you need to nip the illness at the bud, at the level of the vector. That's where, of course, that's what comes in with yellow fever, or mosquito that is also responsible for yellow fever. But again, the attitude of individual towards preventive measures is very key. Because you go to an environment, you see that you are in an overcrowded environment, you're not conscious. Maybe you are in a bus, people are sneezing and coughing. So we should see the need to be able to be preventive. That's why I said that if you are going to any public place, take some of your gadgets. And each time you leave a public place, first of all, go and clean, wash your hands. So we are not talking about face masking. Face masking is as old as Adam. It's not the coronavirus that brought face masks. For instance, everything we do in the hospital most time, we wear face masks. You want to examine the patient, because it's very key. The patient might be having upper respiratory infection. Even you as an attending physician, you might have some illnesses, maybe some flu-like symptoms that can always spread to the patient. So simple measures give simple solution. But again, say it from now to the end of time. A lot of people will say, no, it doesn't matter. Even in public places, like even where the restaurants and all that, the way our vendors, our food vendors handle the food, those are very key. You know, these are areas where when people violate, there are punitive measures. But again, how many persons are being punished for violating simple measures to prevent illnesses? For instance, polio left Nigeria long ago. Before we could say Japan, we say polio came back. Vaccination and all that. There's some part of the notice tomorrow. They hardly even vaccinate their children. That's why I'm talking about the yellow card or even the immunization card. So what we are saying in this forum is that let us see the need to realize that a lot of endemic illness is around us, and the viral hemorrhagic fevers are their fatality rate is very high.
It's very high.
Because it affects the organs, especially the liver and the kidney, of course the lungs. Because I'm talking about the corona, now people thought it's 19 on the past. One of the biggest targets of coronavirus is the lungs. And once they affect the lungs, there will be athletics. And once some of these viral fevers affect the liver, of course, the clotting factors will be affected. And that's what leads to heart failure.
Well, when it comes to medical issue, we seem not to be proactive. We are usually very reactive.
I think the problem we have is that I think we have attitudinal problem in this kind of environment. Even when it comes to the issue of social activities, like even going to vote at the polls, a lot of persons just feel that, oh, that is not my problem. But in life, what goes around comes around. Because one thing about health issues is that once you miss it, it can throw back on us as a problem. Maybe on our spouse, on our offspring, or our defendants. That's where the issue is. That's why all hands has to be on it. If there's anything that should be sung every time in the media or in the social media or what form of media, it's health issues. Because the death rate, whether you like it or not, that's why it's increasing. The world is about 8 billion people. Over 500,000 persons die across every day. And some of these deaths are preventable deaths. And this one we're talking about viral illnesses now. Obviously preventable. For instance, why will an adult have yellow fever? It's paradoxical. Because yellow fever is a preventable disease. Okay, the other day we talked about hepatitis B. A lot of people were calling me on phone. I said, look, hepatitis B is as cheap as less than 12,000 naira. So know your status today and go and take your vaccination tomorrow. Who you want to tell them? The man that called me the doctor, I called him the other day. I said, no, doctor, I'll go and do it. As bad, as deadly as hepatitis B virus, that will cost over 12 billion to cure. Nigerians cannot walk to the nearest health center, even UBTH or other centers, even central hospital, to take their vaccine. Just 2 days of vaccine. I'm talking about people that are even more privileged. When you know that this is the biggest carcinogen to liver diseases. So look at the yellow fever, for instance. I agree with dengue, I agree with Ebola, I agree with Lassa. What about yellow fever? Whose preventive measures have been there in the last 40 years? Okay. I saw a man recently had yellow fever. Why? I said, oh God, why? Where are you from? And I done for 3 years, yellow fever. Vaccination everywhere. So who do you want to
And the vaccination is even free.
The kudos to the government. And the last one they did, that was all called herd immunity. They took it to the market, they took it to the churches. What do you want the government to do? The government will come and force you to take an injection that you're not going to pay a couple. That one is even, the most annoying one is even the hepatitis. Because all these ones are all viral illnesses. You know that this set of illnesses can be contagious. But one thing about hepatitis is that it can be sexually acquired, it can be body contact. Hepatitis B anyway. A is most times it's body contact. Maybe live in hostels, they go to crusade and all those things. So, but again, these things are preventable. If you look at yellow fever, look at hepatitis B, the similarity between two of them is that they can affect the liver. And that's why you saw the word yellow, because there will be what we call jaundice. So there will be changing the color of the eye, so the white eye becomes yellowish. And once that happens, it signals the liver. So that's why we're saying that any of these preventable diseases, let's take it seriously. It's not just the virus, even the bacteria. Look at pneumonia. You hardly see adult pneumonia in Europe and America is not having pneumonia. Maybe because they now have the pneumovirus vaccine. How much does it cost? But the very rich in society, you see they're coming down with pneumonia. That way they're not diabetic, they have no immunity. Because you see pneumonia in the elderly. That way they are diabetic, maybe they are HIV positive, and then that will reduce their immunity. So what we're saying in this forum is that we this media to appeal to the public. Anything that you know there is preventive, please give it priority. Because that's when you're the head of the home. So as a family physician, I believe that any disease that is preventable should give it utmost priority. That's why you see there's too many sudden deaths, too many unusual deaths. It doesn't happen in Europe and America. I said maybe there's flooding, there's maybe
or any natural disaster. Yeah.
People don't just begin to down and unexplain it. So what I appeal to the public is that things that in this discussed today, things that yellow fever is vaccine. So tomorrow, walk into any of the health centers, the Dose government has made it free.
Free for everybody.
For hepatitis B, where they can take some money, but it's still not something that's what doing. It's what doing.
So prevention is better than cure.
It's always the option. They are incomparable, this one, because you prevent a problem. Just like you have a break problem. So, let me manage. What
will you do then?
That's the issue.
But the thing is that once it comes to health, we are usually very careless about that. We don't take our health serious. But I'm hoping that from this moment on, a lot of us will begin to take our health serious. Dr. Joe, our time is fast spent. I wish we could go on and on and on. But we'll do this again. We'll do a part 2 of this topic again so that you'll be well educated. Any disease that can be prevented, please do. All right, when you do that, you will save yourself and, of course, a lot of persons around you, particularly when it comes to viral hemorrhagic diseases. All right, Dr. Joe, thank you for time spent with us. We'll see you again on Monday. Bye-bye.